Top 10 common signs you're deficient in vitamins and how to treat them. Consuming a well-balanced and nutritious diet has many rewards. On the other side, a nutrient-deficient diet can cause a variety of health complications. These signs and symptoms are your body's way of warning you that you may be deficient in vitamins and minerals. Recognizing them can help you make dietary adjustments. In today's video, we will share with you the top 10 common signs of vitamin deficiency, as well as how to treat them. Number 1. Brittle hair and nails. Brittle hair and nails can be due to a wide variety of circumstances. One of them is a biotin deficiency. Biotin, often known as vitamin B7, aids in the conversion of food into energy in the body. Biotin deficiency is uncommon, but when it happens, the symptoms include brittle, thinning, or splitting hair and nails. Chronic weariness, muscle soreness, cramping, and tingling in the hands and feet are also signs of a biotin deficiency. Long-term use of antibiotics and other anti-seizure drugs is also a risk factor. Consuming whites of uncooked eggs might also induce biotin deficiency. According to research published in the American Journal of Clinical Nutrition, raw egg whites have avidin, a protein that binds to biotin and can prevent it from being absorbed. Adults with brittle hair or nails can consider taking a biotin supplement with about 30 micrograms per day. Number 2. Mouth ulcers or cracks in the corners of the mouth. Inadequate intake of certain vitamins or minerals may contribute to lesions in and around the mouth. Mouth ulcers, often known as canker sores, are frequently caused by iron or B vitamin deficits. According to one study published in the Journal of Oral Surgery, Oral Medicine, and Oral Pathology, persons with mouth ulcers are twice as likely to have low iron levels. Angular cheilitis is a condition that causes the edges of the mouth to crack, break, or bleed due to excessive salivation or dehydration. It can also be induced by a diet lacking iron and B vitamins, particularly riboflavin. Poultry, fish, dark leafy greens, nuts, and whole grains are all high in iron, and they are all good sources of thiamine, riboflavin, and pyridoxine. If you're facing these indications, consider the foods listed above in your diet. Number 3. Bleeding gums. Bleeding gums can be due to incorrect brushing techniques, but it can also be caused by a vitamin C deficient diet. Vitamin C promotes wound healing and immunity, while also acting as an antioxidant to protect cells from harm. Because your body does not produce vitamin C, the only way to maintain adequate amounts is through diet. Vitamin C insufficiency is rare in those who consume a lot of fresh fruits and vegetables. Many people, on the other hand, do not eat enough fruits and vegetables regularly. Long-term insufficiency symptoms of vitamin C include bleeding gums and tooth loss. Scurvy, which suppresses the immune system, weakens muscles and bones, and makes people tired and lethargic. It is another devastating effect of chronic vitamin C insufficiency. Number 4. Poor night vision and white growth in the eyes. A nutrient-deficient diet can lead to eyesight difficulties. Low vitamin A levels, for example, are frequently linked to night blindness, a condition in which people's vision is impaired in low light or darkness. The formation of rhodopsin, a pigment present in the retinas that enhances night vision, requires vitamin A. According to research published in the Journal of Nutrition, night blindness can lead to xerophthalmia, a disorder that damages the cornea and eventually causes blindness if left untreated. The white growth can be removed to some extent, but it will only go away completely if the vitamin A deficit is addressed. Most people should avoid using vitamin A supplements unless they have been identified with an inadequacy, because vitamin A is a fat-soluble vitamin. It can build up in the body's fat stores and become poisonous if ingested in excess. Number 5. Scaly patches and dandruff. Seborrheic dermatitis, SB, and dandruff are two skin conditions that affect the oil-producing part of the body. Both include flaky, itchy skin. Seborrheic dermatitis can affect the face, upper chest, and armpits, while dandruff is typically isolated to the scalp. These skin problems are most common in the first 3 months of birth, during puberty, and in mid-adulthood. According to a study published in the International Journal of Trichology, both illnesses are fairly frequent. Dandruff or seborrheic dermatitis affects up to 42% of infants and 50% of adults at some point in their lives. Many factors can induce dandruff and seborrheic dermatitis, including a nutrient-deficient diet. Low blood zinc, niacin, vitamin B3, riboflavin, vitamin B2, and pyridoxine, vitamin B6 levels, for example, could all have a role. While the link between a nutrient-deficient diet and these skin disorders is unknown, those who suffer from dandruff or seborrheic dermatitis may benefit from increasing their intake of these nutrients. We've made it halfway through our list, and we sincerely hope you've enjoyed it so far. Please don't forget to subscribe to my channel. Hit the like button and ring the notification bell if you want to see more content like this. Let's move forward with the video. Number 6. Hair loss. A common sign is hair loss. Research published in the Journal of the American Academy of Dermatology shows that at 50 years of age, up to 50% of adults lose their hair. Many supplements claim to keep hair from falling out. Many of them include a combination of nutrients. These supplements appear to enhance hair development and prevent hair loss. However, research on the effects of such supplements in the absence of a deficiency is sparse. It's also worth mentioning that taking vitamin and mineral pills without a deficiency can make hair loss worse. Number 7. Red or white bumps on the skin. Keratosis pilaris is a skin disorder that creates bumps on the cheeks, arms, thighs, and buttocks. Corkscrew or ingrown hairs may also accompany these little pimples. The illness usually starts in childhood and gradually fades away as an adult. The exact source of these little bumps is unknown. However, they may arise when the hair follicles create too much keratin, causing raised red or white lumps on the skin. Keratosis pilaris may have a genetic component, indicating that if a family member has it, a person is more likely to get it. However, it has also been noticed in those who consume low vitamin A and C diets. Number 8. Restless leg syndrome. RLS, also known as Willis-Ekbom illness, is a nerve ailment that causes annoying or distressing sensations in the legs, as well as an insatiable desire to move them. According to the National Institute of Neurological Disorders and Stroke, RLS affects about 10% of Americans, with women twice as likely to be affected. When most individuals are relaxing or trying to sleep, the need to move tends to increase. While the exact causes of RLS are unknown, there appears to be a correlation between RLS symptoms and iron levels in the blood. For example, a study published in the Journal of Movement Disorders found a link between low blood iron levels and the severity of RLS symptoms. It has also been found that symptoms are more common during pregnancy when women's iron levels tend to drop. Number 9. Changes in mood. Sure, everyone has a bad day now and then, but getting enough of the essential nutrients that promote brain function and mental wellness is critical. Increase your omega-3 fatty acid intake while you're feeling down. They are present in fatty fish like salmon and sardines and are necessary for regular brain function and cell communication. Number 10. General aches and pains. Muscle pain, which is sometimes misinterpreted as a sign of aging or even an exercise-related complaint, is an indication of vitamin D and magnesium deficiency. Low magnesium levels are linked to muscle stiffness, tightness, and cramping, whereas low vitamin D levels are linked to muscle weakening, muscle discomfort, and bone pain. Vitamin D and the mineral magnesium are both available as supplements in the form of vitamins and tinctures. A diet lacking in vitamins and minerals can result in a variety of symptoms, some of which are more common than others. Increasing your consumption of foods high in the right vitamins and minerals will often help you resolve or significantly reduce your symptoms. Do you find this video informative or helpful? Let us know in the comments section below. Make sure to subscribe so you don't miss out on my future videos. Don't forget to like and share. Stay healthy!